I would like to share with you a case example of using therapeutic ultrasound to heat tissue to make it more extensible. This is a client that I actually treated. They were a 24-year-old with a left dorsal wrist ganglion that they had surgically excised. Interestingly enough, the surgeon also did a first dorsal compartment release, which was a surprise to the client. But anyway, that's what they had done. This client came to me about 3 weeks after surgery. At the initial post-op visit, about 3 or 4 days after surgery, the client was complaining of a lot of pain. And the hand surgeon said, well, that'll get better. Saw the client again 2 weeks post-op, and the pain was not better, it was actually worse. And at that point, the surgeon sent them over for occupational therapy, and I saw them then about 3 weeks post-op. When I saw this person 3 weeks post-op, they were in just excruciating pain, 10 out of 10 on a verbal scale, 0 to 10, with any wrist movement. Any wrist movement was just excruciating. Visually, they had a very adherent dorsal wrist scar where that dorsal wrist ganglion had been excised. The skin was just glommed down to the tissues underneath. Their cold, that is, not preconditioned, active range of motion was very limited. On the right for wrist flexion, they had 80 degrees. Left for wrist flexion, they had only 10. Right for wrist extension, they had 75. Left for wrist extension, they had 50. Certainly better than their flexion, but also limited. And the grip was also very limited, about 75 pounds on the right, only 20 pounds on the left. So I initiated treatment with this client. I saw them 2 times a week for about 7 or 8 weeks. And what I did with him was therapeutic ultrasound to the dorsal wrist scar and adhesions for the purpose of heating that tissue to increase extensibility. The parameters used were 3 megahertz, 0.5 watts per square centimeter, spatial average intensity, continuous duty cycle, 7 minutes. I used the 5 square centimeter ERA transducer and covered an area on the back of her wrist 2 times the ERA, so my coverage area was 10 square centimeters. And as much as I could during that time, tried to put her hand in a little bit of wrist flexion and or fist as tolerated. Initially, it was not tolerated. She only had the 10 degrees of wrist flexion, and in that 10 degrees of wrist flexion, she couldn't fist at all. But as time went by, that got better and better, and so each session I was doing what she could do. After I did that therapeutic ultrasound to warm up those scar tissues and adhesions, we popped her into the fluidotherapy with active range of motion, so moving the wrist, moving the fingers for about 20 minutes. This was to hold the tissues at that temperature of vigorous heating that I had achieved with the therapeutic ultrasound. And by putting her in fluidotherapy after, I was able to hold that temperature for a longer period of time so she could work with it. After the fluidotherapy, we did joint mobilizations, wrist stretches, purposeful activities, and then her home exercise program consisted of therapy, and I don't recall exactly what I used, but I'm sure it was either extra soft or soft, so the tan or the yellow. Gave her some Dicem to mobilize the scar. So over the scar, you take a little 1-inch square of Dicem, put it over the scar, and then with your other hand, you're moving the Dicem and the skin underneath it, and it just gives you a little better traction for scar mobilization. Had her doing stretches and also wrist strengthening at home within the range of motion that she had. So here you can see the application of the therapeutic ultrasound with a wrist flexion stretch. This was toward the end of the whole length of stay. So you can see here she has pretty good wrist flexion. This was still a good stretch on this particular day with the therapeutic ultrasound. Initially, it would have looked very different from this because she wasn't able to flex her wrist. But you never think of taking the picture until it's better. But that's what application looked like. The results of this treatment were pretty dramatic. During each session, so from when she walks in the door, measure her cold before any treatment, and then measure her at the end of the session. So during each session, there was about a 10 to 15 degree increase in wrist flexion, active range of motion. And this is something that I really like to do with all my clients is measure them when they walk in the door, measure them when they're walking out the door, and that way you can really tell, what was the effect of whatever you happen to do that day. Of that 10 to 15 degree increase during each session, from beginning to end of each treatment session, when she came in the following, the next day she was coming in, 2 or 3 days later, she generally held about 5 degree gain between sessions. So, cold initial measurement of the prior session to cold initial measurement of this session, it was about a 5 degree gain between sessions that was maintained each time. So by 8 weeks post-op, which ended up being about 11 treatment sessions, with some of them missed and that kind of a thing, the client had cold active range of motion measurements of 60 degrees of wrist flexion. You'll remember she started out with only 10, and 70 degrees of wrist extension, and you'll remember she started out with 50. Her grip in her left hand was 55 pounds. She had started out with only 20 pounds. She also had no pain, whereas she had 10 out of 10 pain with any movement when she started, but no pain with movement, no pain with normal use. The only time she had pain is if she, whacked it, like walking through a door and hit it on a door frame or something. In that case, her max pain was about 5 out of 10 if she were to bump it or hit it. So here is her movement at the end of treatment, and you can see she has good wrist flexion, has some finger flexion along with that, isn't really full composite wrist and finger flexion yet at this point, but she's doing a lot better than she was. And again, she had really no pain with use. You can see the little incision for that first dorsal compartment release, which happened for unknown reasons, and probably can't see in this picture her dorsal wrist ganglion incision, but this is what she looked like at the end.